Hello everybody, my name is Edgar and today I'll be doing a newborn assessment. First off, we do hand hygiene and I'll be putting on the gloves. Good. So, first I'll check the vital signs. I'll grab a thermometer. I'll check the baby's temperature. I'll use the auxiliary because that's what you should do for a baby. And the temperature is usually between 36.5 to 37.2, I believe. And also, I'll check the weight of the baby as well. The baby should be covered because it's kind of cold. I'll check the weight of the baby. The baby weight should be between 2,500 grams to 4,000 grams. So now after that, next thing I'll do, I'll check the baby's skin. I'll look for any type of lesions, any type of rashes, or any type of abnormalities. I'll check for like birthmarks, if there's any bumps or any signs of jaundice. After that, I'll start doing the measurements. So I have my imaginary ruler. I'll check the measurements between the back of the occipital of the head to a little bit above the eyebrows. It should be about 32 to 37 centimeters. Meanwhile, I'll check also the chest. So I'll take my ruler, or measuring tape rather, and it should be about 30 to 35 centimeters. Then I'll check the length of the baby. It should be about 48 to 52 centimeters. Once I have my numbers, I'll write that down. Next, I'll assess the skull. I'll check for like any suture lines. I'll check for any C-flor hematoma. I make sure everything looks okay. Nothing is off, or nothing is abnormal. Excuse me, I have a cold right now. And then I'll check for any bruising and also any swelling. Baby seems alright. That's good. After that, I'll be checking for any strabismus. So I'll take my light and I will shine it over the baby's eyes. It should be reacting to lights. I should be checking also to see if there's any white spots, if anything looks deformed or anything like that. So far, the baby checks out good. And yeah, I'll also check the epithelial folds. And also, I'll check if the ears line up to the inner canals of the eye, which they do, which is good. Now, after that, what else would I be checking? I'll check the placement of the ears. Okay, I already mentioned that. I'll check the patency of the nose to make sure each nostril is working well. So, I'll check the nose. That one is well. That one as well. That's good. Now, I want to check the reflexes of the child. I will touch right over here to see if the baby turns. Then I'll also check inside the mouth. I'll check if there's any, what's the word? Pearls. And I'll also put my glove inside the mouth. I'll check the baby sucking reflex. Meanwhile, I'm in there, I'm also checking for the hard palate and the soft palate as well. Making sure there's like no cleft or no cleft on the lip. Everything looks well so far. And now, what else do we have here? I've done the mouth, I've done the clefts. Epstein pearls, that was the word I was looking for. Next, I'll check the neck. The neck is good, there's no webbing. The clavicles are right, nothing's broken. That'll be good. Then after the neck, yeah, I'll check for any masses as well. Everything's good in that part. So after the neck, I'll check the chest. I'll look at the chest, make sure it's it's not concave, it's not flat, and I'll also check the nipples as well too. I'll make sure there's nothing going on, any oozing or anything like that. So after the chest. Next thing I'll check will be the baby's cardiovascular. So I'm gonna listen to the baby heart. I want to warm it up. Babies are sensitive to cold. Alright. If I hear any type of murmurs, that's normal for children this age or infants this age. And then I'll stop over here. I will listen to the apical pulse for about 1 minute. It should be beating at about 110 to 160 beats per minute. So far everything's good. So after that, I'll listen. I'll feel for the baby's pulses. So with babies, you're supposed to listen to the brachial and the femoral. So I make sure the pulses are good and I can feel them. Those are good. Oh, femoral's up here. Sorry. Those are good as well. In the case if I see like any bluish, any cyanosis on the baby's fingers or toes, that's a pretty normal finding. So that wouldn't alarm me so much. And yes, I'll also listen to the baby's lung sounds. If I hear any type of crackles or anything that sounds like there's food in there, it shouldn't alarm me. Mainly because the baby's in transitioning and just using their lungs, so the fluid is still coming out. Alright. After I do that, next thing I'll do is look at the baby abdomen. I want to make sure it's nothing abnormal. I'll listen first to the baby's abdomen. I'll start with the lower left quadrant. And I'll work my way around. Everything sounds well. And now I'll palpate. Okay. And also I'll check the umbilical. Make sure it's looking like how it's supposed to. It should be, the umbilical cord should have 2 arteries, 1 vein, I believe. Everything checks out well, that's good. And also the bowel sounds, which I already checked, which is active as well. So now, what else am I gonna check? I'll check the genital. This is a baby girl, so I'll check the labia minoris, make sure it's good. If it's swollen, that's like a normal finding of a newborn. Everything checks out, that's good. And now, lastly, I'll check the extremities. Check the arms, it's symmetrical. Check the legs, it's symmetrical. I want to check the ortolan. So up and out, that's good. Then now I'll check the Barrow test, in and down. That's good. The baby's legs are intact. Then after that, I'll check the length of the legs, which I've done. I'll check also the back of the baby. So I want to move the baby easily. first. Well, you gotta have the baby breathing. So I'll check the baby's spinal cord, make sure it's intact. I want to check behind the legs, make sure there's no any skin folds which should look out of place or just uneven. So that's good. And also I want to listen to the lungs of the baby as well. Alright. Baby sounds good. A little crackles, but like I said, that's a normal finding. Alright. After that, I want to check the reflexes of the baby. Baby's up. The baby should be trying to walk, even though it can't, but it should have at least the motion of it. That's good. Then also the movements are coordinated, which is also a good thing. I want to check for a tonic neck. Okay. Then I'll check the grabs of the baby. What is it called again? Plantar and palmar. So this is the palmar. This is the plantar grabs. And lastly, I'll check also the Babinski. So I should start from the back of the toe. The back of the foot to the front of the toes, and the legs should flare out. And so far, everything checks out well. This is a nice, healthy baby. And that will conclude my head to toe assessment. Thank you.